I never know where to start because there's so much I want to share with you. So I was thinking what might be helpful, just given the format of this, is to talk a little bit about some of the courses in public health and the programs here in the state, talk about the professions. There's just, I mean, this is a very much multidisciplinary field. So talk about some of the different tracks that you can focus on in public health, given, you know, what you've told us in terms of your interests. And then maybe we can share with you a little bit about some of the opportunities that we see here in the state of Maine, and even some trends nationally in the field of public health. Does that seem like it would be helpful?
Absolutely.
Okay, so in terms of courses and programs, a good place to start, and of course I'm going to be shameless, if you're really interested in this field, is a basic public health course. The Lewiston-Auburn College has a certificate, and I know you've got information here about the minor in public health. That'll give you good grounding on just the scope of this profession, not only the breadth of issues that we talk about, but also it'll give you a sense of the different focus areas for the study of public health. Most schools of public health and programs focus on 5 core courses or 5 tracks. One is around the social and behavioral sciences, as was mentioned. So that would include a lot of your health education, health communication, social marketing, how do you convey messages. Another track is around the epidemiology and biostatistics, which is well represented here. That's around disease surveillance and tracking. There's another track that's around environmental health. So what's out there in the environment, the ambient air, arsenic, radon, whatever it is, that focuses on environmental health conditions and how that impacts populations. The other piece is around health policy and management. And Diane, you indicated that you're in this leadership program and you're interested in management and HR. That may be a good track for you. That's really about managing public health programs.
Is that what it's called?
It's health management and policy. Yeah, different programs call it different things, but that's essentially what it is. And it's healthcare and public health settings. And what's the 5th track? What did I say? Social behavioral. Did I say policy?
International.
It could be global health. Some have global health. And maternal and child's health. Epi, biostats, social and behavioral, which often has the maternal and child's health in it. Environmental health, and the health management and policy. Okay, that's all 5 of them. So that's typically the course of study in a public health program. What's nice about the minor in public health here is you've got sort of some core courses that give you a good grounding in this field. Epidemiology is something that you'll have to take if you're involved in public health. It's the basic science of public health. So it's, what are rates of disease? How do we use data to inform our decisions about what we should set as priorities and what we should focus our scarce public health resources on? Other programs in the state are, well, of course, I'm shamelessly, because I'm from the Muskie School, I'm going to tell you that we're really excited that we have a new MPH that's going to be launched as of the fall of 2012. So that's a master's in public health degree. That is, at the master's level, that's the degree that is, I would say, most recognized in our field, the MPH. And in the last 10 years since I've been in Maine, I can tell you there has been an influx of MPH degrees. It's one of the things that we look at Muskie when we hire. I know when I've worked with the Maine CDC on key hires there, they are looking specifically for an MPH degree. But there are other credentials as well. This is very much a multidisciplinary field. In those 5 areas that I mentioned, you have social and behavioral health scientists that are doing research on what is it related to school nutrition and menus that we can learn that's going to actually make an impact. You've got community-based groups and advocates that are doing work. You've got sanitarians and restaurant inspectors who are actually going out there in the field and inspecting our restaurants. You have biostatisticians and epidemiologists that are doing all the disease surveillance. You've got program managers. You have, so many. I mean, we could probably go on for 20 minutes about the different disciplines in public health. If you're interested in the scope of all of these disciplines, Pfizer, the pharmaceutical company Pfizer, has a terrific website that actually has great resources for students that is called Careers in Public Health, and it actually profiles policy advocates. It profiles somebody who focuses on community mental health. It focuses on somebody who focuses on domestic violence. I mean, pretty much any public health topic you can think of, there's a profile on there, and it'll really give you a good sense of what you can do in this field. In terms of opportunities in Maine, as Heidi mentioned, we're really different in this state. We don't have a network of local health departments. We've got this mixed system with a fairly centralized component, but then also 2 local, fully functioning health departments. So the jobs are a little different than you might find in other states. Obviously, we've got major health systems like Maine Health that is employing a lot of MPHs, a lot of people coming out of our program, a lot of people with formal training in public health. That's a health system in Portland, and they quite honestly do a fair amount of population-based stuff. Obviously, there's the state and local health departments. The state health department and the 2 local health departments. We've got a network of community coalitions. You know, some states have public health institutes and universities that employ folks. Environmental health, that may be a different group, maybe some nonprofits doing that work. So again, it's just, there's a mix, I think, of opportunities, and in Maine it looks a little bit different than other states just because our system is organized a little differently. But I'm going to stop there and let the other panelists chime in, and then maybe we can have a dialogue.